The World Health Organization has advised people to delay non-essential dental care.
But the American Dental Association disagrees, saying dentists should have never been closed in the first place. Eyewitness News reporter Courtney Carter caught up with one local practice about why they feel their doors need to stay open.
The Dental Associates of Rhode Island say dentistry is an essential business, but they're not being considered as such. The American Dental Association, better known as ADA, says respectfully they disagree with the World Health Organization's new recommendation to delay routine dental care due to COVID-19.
All our services are actually essential.
The ADA says since March, when the coronavirus was classified as a pandemic, dentists were forced to close their doors and postpone all care not considered an emergency. Rupesh Udeshi, dentist and owner of Dental Associates of Rhode Island in Johnston, says the months they were closed already had a big impact on the health of their patients.
We've had a great backlog and also problems that were essentially, which were minor, which we could have prevented from being something major, have become major. Now we're seeing them, now it's something a lot more severe because it wasn't treated. Now rather than a cavity, now they need a root canal. And some people maybe needed a root canal, it was starting to bother them. Rather than a root canal, now they need to have the tooth out.
Udeshi says they need to stay open, and even though the ADA agrees, there are some rules. The dental organization is calling for the highest level of PPE available, which is why the dentists here wear a mask, goggles, and face shield. Co-owner Jennifer Udeshi says patients should not be scared to come back in. She says they stagger patients and thoroughly sanitize after each one.
We've got a fogger system and an electrostatic sprayer. So what we're doing is we used an EPA-approved solution that goes into the foggers, and we spray it in each of the operatories, each of the rooms, and the reception areas between each patient.
There's such a huge connection between the mouth and the rest of your body. I mean, any bacteria, any pathogen which is in your mouth, it flows into the rest of your body.
Now, there are some things that dentists are still not doing due to COVID-19. They're not doing ultrasonic cleanings due to airborne particles. In Johnston, I'm Courtney Carter, Eyewitness News.